Alrighty, we are live. Good evening, everybody. My name is Frank, the founders of Rec for Responders nonprofit, and I'm an active law enforcement officer in the city of New York. Responder Talk is ran every Sunday at 7 p.m. Eastern, which is our topic or speaker meeting via Zoom. This group is strictly for first responders and military personnel, active or retired. First responder personnel includes law enforcement officer, firefighter, EMS, EMT, corrections, nurses, police dispatcher, and as previously stated, military personnel. Please, whatever you hear here, let it stay here. This is a safe haven for us. I encourage everyone to state what department they are in or work for. This shows we are all over the country and we're in this together. If you know anyone who'd be interested in joining Responder Talk, please let me know. Responder Talk covers topics such as wellness, nutrition, fitness, and recovery. Recovery is not defined as just substance abuse. Recovery is an everyday practice of working on yourself to make yourself a better you. You can be in recovery from substance abuse, trauma, anxiety, depression, relationship difficulties, and so on. Here on Responder Talk, we hope you feel comfortable enough talking about your experience in life and hearing suggestions from first responders from all over the country. And with that, I welcome you all. Good evening. Our last meeting, January 2024. Time is flying, and we're going to end January 2024 with a great guest speaker. As previously stated, tonight we have the pleasure and the honor to have Dr. Mark Cucuzzella, who is also a veteran, who is going to speak about a bunch of different topics. So, Dr. Cucuzzella, welcome. Thank you so much for coming on tonight, and it's an honor, and the floor is yours.
That's right. It's an honor to be back. I think, Frank, it was probably like 6 months ago we chatted, and I've learned a lot in the last 6 months. So for those of you on the call, a little of my background. So I'm a 29-year Air Force vet, did most of my career in flight medicine, but then transitioned to kind of public health, fitness test, training people to pass the fitness test, training some of the special ops guys down in Medina, combat controllers, PJs, and I'll now my job, I've been 9 months working in a VA clinic exclusively for post 9/11 combat vets. So it's a privilege to be serving that population, but it's kind of a test tube for what is real. And we can speak in kind of cop and vet language. I mean, so in 9 months after working with this group of post 9/11 combat vets, so all of the patients I see, some of them have seen live combat and some just deployed, down range, but more inside the wire. But it's a pretty hardy group of people that have kind of big T trauma. And so, I read Kevin's book 10 years ago at the advice of Greenie, and I was like, oh yeah, that all kind of makes sense. But then, like, after you've worked with hundreds and hundreds and hundreds of veterans, over just 9 months, it's like, okay, the shit is real. The shit is real. And I gave a talk, and I think you guys saw the 150 slides. So it's like, wow. So I gave my first presentation on this topic of the connection of PTS and metabolic illness a couple weeks ago in Florida, because we all kind of have hypotheses. But I started gathering data at day one, and then when you gather data, you can start to put the connections together to see if your hypotheses are real. So when I started at the clinic, the post 9/11 clinic at the Martinsburg, West Virginia VA, I just started collecting data on the patients or veterans who had metabolic illness. So who fit criteria to be in my database. So you had any of the features of the metabolic syndrome. You had pre-diabetes, you had high triglycerides, low HDL, you were on blood pressure medicine, diabetes medicine, already full type 2 diabetes, or visceral fat. You were obese, technically BMI over 30, but you're carrying the weight around the middle because, some of these guys, have BMIs like twice mine, but they're perfectly well. They're still kind of combat ready, right? They're fit and strong. And so we put all those veterans in a database. And my clinic is not an obesity clinic or a weight loss clinic. It's just a regular primary care clinic. So when any veteran met the criteria for metabolic illness, obesity, type 2 diabetes, pre-diabetes, all the markers Greenie talked about, we gave a 10-minute intervention, meaning I explained to them what insulin resistance was. And for those of you on this call, how many of you would guess a single veteran actually had heard of that term before? Yeah, the answer was 0. I see John out there, 0. So, have you heard of metabolic syndrome, or do you know you're pre-diabetic? So it's actually like pretty easy audience because they were completely oblivious to any of this. So do you understand? You'd show like, this is my laptop here. So I would turn the laptop around. Oh, yeah, your A1C is 6.1. You know that? Do you know what that? Well, I don't know what that means. So you'd kind of just explain to them what the numbers meant, and then I would draw out the little image, you know, of insulin sensitive, insulin resistant, you know, and just like probably the young law enforcement officers who are now middle age, and this, because this group was once uber well, these were combat vets, so I could safely ask this question because they were once insulin sensitive, or else they never would have gotten in. You know, remember the days where, you know, you could, you know, go ruck march 12 miles, come back to the chow hall, eat whatever the heck you wanted, you know, and you were good, you were fine. You could eat bread, you could eat pasta, you could have monsters. And like, oh yeah, that was me. You know, you draw a little diagram. Yeah, you could throw 30, 40 teaspoons of sugar, muscle, liver, fine, a little knock on the door, insulin. You store the glucose, go down range the next day, life is good. When did that change? You know, most of them, it's like, gosh, retirement, you know, took a desk job, got promoted, you know, senior officer, senior enlisted. So, you know, but most of them, you know, when they got out. So what started to kind of become a common theme is, you know, when I got out, and yeah, and then I connected these. So right now, out of about 1,000 patients who I've seen first visit, you know, just being in the clinic, I'm a primary care doctor. We have 1,200 veterans. So there's a couple hundred yet who haven't shown up in the first year. They're probably coming. They're mandated to come in at least once a year, or else they could lose their benefits. Well over half met the criteria. So over half of these veterans meet the criteria for metabolic syndrome. So it's a huge group. And most of them are within 10 years of their military separation or retirement. So this has happened really quick. And in veteran populations, which to me is kind of fascinating. And if you have any questions, throw it in the chat. My chat's open. This isn't meant to be a lecture. It's more, I'm just kind of free flow thought, because this is your world. This is what you guys are living in. So it became very apparent that the veterans who had the worst of this condition, you know, I look in their, I hate the word problem list because people aren't problems, you know, PTS, you know, depression, bipolar, anxiety, you know, some mental health disturbance, you know, that was associated with being downrange and hypervigilance. So it's everything that Kevin has written about and said is absolutely true. So, you know, a way that I explain that, you know, so I actually have Kevin's book in the room, you know, and I'll draw the roller coaster. But another really powerful read that I would encourage all of you all to read if you haven't already, so is the book by Dave Grossman, On Combat. You know, and I mean, you could just throw in the chat. Are most of you familiar with that book, On Combat, Dave Grossman? So maybe yes, maybe no. But Dave Grossman literally wrote the book On Combat because that's the name of the book. So Dave Grossman would be your military equivalent of Kevin Gilmartin, and listen to him on a podcast. So what Kevin describes are threat assessment levels, which is similar to what Kevin talks about, you know, with his hypervigilant state, and then you crash. So what Dave Grossman describes is condition white, yellow, red, and black. And condition white is, if any of y'all on this call hope to be fishing in Florida one day with a pension, with not a worry in the world, like maybe not, that'll be you. So you're not highly performing in that state, but you're total chill. Life is good, you know, and that's the glorious sunset that most cops and veterans never get because they die before their time of cardiovascular disease. Then he talks about condition yellow, and condition yellow is like, I was a flight doc. So yellow is like mellow yellow. It's like the pilots, right? It's like they're good, they're calm, they're inside the wire, right? Which is how Kevin describes the firefighters, right? So they're like inside the wire, you know, they're at Bagram Air Base, pretty safe place, you know, relatively to being outside the wire, but they're ready to roll, but they're calm, right? They're not like at this every minute, like everything is a potential threat. Everything is a potential threat. And then condition red, and you're highly functioning in condition yellow, like you're ready to roll, you're good to go, and you're ready to respond, you know, when the alarm goes. And then condition red is outside the wire. This is cop on duty, right? There's no, like, you're not inside the wire. There's no condition safety. Every single thing is a potential threat. in that condition is, adrenaline, is cortisol, it's stress, your sleep, you're highly focused, highly functioning, uber laser focused, but that's a tough condition to maintain. And then condition black is probably most of you on this call who are a cop or a veteran, if you've been in combat, have gone to condition black. Condition black is fight, flight, freeze. You're frozen, right? That's that condition you don't want to be in. And Marines and special ops guys, they all kind of train themselves through stress acclimatization, which is LE training. They train themselves to be in this condition gray, where like you can actually raise that high level of performance, where your heart rate's so high, your adrenaline is so high, you should be condition black, which is you're useless, but you're actually highly functioning. So that's the way these guys roll. But it takes its toll. So back to the database. So in 9 months, they come in once. We do and I see Amy's on this call, and thank you, Amy Berger, because I give them in the 10 minutes you have to talk about this. I give them a book called Low Carb on a Budget, which I wrote with a colleague who is awesome with cooking, Christy Sullivan. And then I give them Amy's book, which is Low Carb for Law Enforcement. And I say, well, look, this is a book highly relevant to you. You could just cross out law enforcement and put vet. The same rules apply. And take these home and read them. And that's all you got, right? Then you're on to the next patient. You don't have coaches, nutritionists, dietitians, any of this stuff. And in the follow-up, so we have about when I put the lecture together, we have 190 patients come back, who had at least one follow-up in 3 to 6 months. So what we're seeing is good news. And I'll explain to you some of the things that aren't going well, which is helping me learn. So about a third of the patients crush it. They're in good mental health. Our average weight loss across the board in that group is 15 pounds, which is pretty good. It's over 5% of body weight. There's a program called VA Move, which is the VA's highly funded coaching program, to try to help people lose weight. And they select to do that. So these are people who actually want to lose weight. They're walking in my clinic just for a regular visit. So for the VA Move program, which is most of you out there who have busy lives, you don't want to be managed. You're busy. You want to just be given tools, right? You don't want someone to manage you, control you. At least that's my impression, but the data bears it out. Only 4% of post 9/11 combat vets who are overweight, who enlist or enroll in Move to lose weight, stay with the program at a year. 4%. So, and I think the standard narrative is, well, these guys just don't want to do it, right? The program's good, but they don't want to do it. But if 4% of people stay with it for a year, my opinion is it's kind of like if 4% of kids are passing the test and 96% are failing the test, you can't blame the kids. There's something with the program. If one kid out of 100 fails the test, it's a test for LE entry or something. It's one of your written technical tests, and 1 out of 100 fails. There's probably something about that kid. They have a learning disability, home dysfunction. So 4% stay with this Move program. And of the people that stay, that small minority that stay, the average weight loss is 5 pounds at a year. So even, quote, best methods, which involve a lot of engagement, a lot of intervention, a lot of control, the outcome's not good. And when they compared the veterans who have PTSD with the non-PTSD, it was like 6 pound weight loss for no PTSD, 5 pound weight loss for PTSD. And they called that statistically significant. It's in one of the slides. And Frank, you could share that again with the group. I did not go through all those slides in the talk, but I left them all as a reference. So if people actually wanted to go read all these articles, the presentation even has a Dropbox folder that has all the original articles are in that Dropbox folder, because it's, I'm just beginning to get into the rabbit hole of this condition. So the standard is not working very well. Now, veterans, 25% of veterans have type 2 diabetes. And I'll repeat that. 25% of veterans have type 2 diabetes. That's over half of the US average. So they have 2 to 3x times risk of type 2 diabetes than non-veterans. And what's fascinating to me that we have to explain is that these were not the kids that were already pre-diabetic in high school. So now it's not going to surprise me if 80% of adults are type 2 diabetic in 40 years, because they're all pre-diabetic now in high school. They just don't know it. And it's like Wally. But these were guys who went down range outside the wire in combat. These were SEALs. These were Marines. These were like athletes. And now they have a higher diabetes rate than the people that were just playing video games in high school. So what the hell is going on? Right? Like, did they just get gluttonous and lazy? So everything Kevin says is I believe true. So back to the ones who are coming back. So our average weight loss is 15 plus pounds. A1C's down 0.7%. Medications are down. Our insulin use is down. Many stopped. So we're tracking the same data that Virta Health tracks, that Dr. David Unwin tracks. So it doesn't matter if you fix someone's A1C, but you crank up their insulin more and they die of heart disease. So the only way to get people better is to get them better. And we actually have a poster in my clinic is our mission statement. And I didn't put this up until about 9 months. Our mission is to restore your warrior physical and emotional health. So I'll repeat that. Our mission statement is to restore your warrior physical and emotional health. And I think the first day I walked in, I wouldn't have been able to make it that clear. And I don't think I would have put the emotional health, because I didn't get that. I didn't understand that fully, even though I'd worked with the physical health for the same group when they were active duty. Like when I was training combat controllers and PJs how to run better without getting hurt, I didn't have a clue what was going on in their brain after their 5th deployment. So, I understood fascia and knee pain and, all that like mechanical stuff, how to run, how to do aerobic training, strength training, like all that physical, but I didn't know anything about their emotional health at all. So when they come back, people are falling into a couple groups. There's those who are like doing well. They get it. We've had people lose 70, 100 pounds, full diabetes remission, throw their insulin away. And we've all heard those stories. That's like Johnette, right? She got it. I did it. I'm all in. No looking back. Like everyone else is a flat earther. But it's crazy. But so that's a good percent are there. But then once every couple days, there'll be someone who's gaining weight. They have the information. They have the book, 10-minute visit, right? We don't have much else. But man, how's it going? How's your PTS? They look at, are you still like scanning everything, stressed about everything? How's your emotional health? Like I had one guy and I put his slide in the talk, the majority of them are going down, right? Average weight loss, 15 pounds. And then I had a student with me. And so patient number 1 had lost 50 pounds off his diabetes medications. This is cool. This guy's on it. He's doing great. Then the next patient had gained 30 pounds. And I was like, dude, how's your life? And he explained to me what his job was. So he's Secret Service for the State Department, sleeping, doing night shift, sleeping in his office, going through a divorce. I was like, okay, we don't need to talk about carbohydrates today. Yeah, no shit. It's visceral, right? So that term, I think another book other than on combat that for those, so the folks that are really struggling. So I made in my data sheet, I have a chart for their mental health condition. All of this is IRB. For those of you who are medical, it's IRB approved. So I'm allowed to collect this data, present this data without patient identifiers. And at a year, I'll have more data that we can learn something from. This is just a natural experiment. Like, what are we learning? So I have a column for their mental health disorder. Do they have one or they don't? And when they have one, it'll be I'll have a PTSD, depression, anxiety. And when you look at these diagnoses, so when we say, oh, they have depression, not PTSD, so it's, if you listen to Bessel van der Kolk, so the book is, how many of y'all have read The Body Keeps the Score? So like maybe a hand up the body. Yeah, Frank, a useful book. Yeah, he's like, yeah, like I need to read that book like 4 times and listen to it 3 times on Audible, and then step back. And so I think the three lords of the ring would be who have been in this, like they're like Chuck Yeager. So if anyone's Air Force, like if Chuck Yeager says this is how he does his pre-flight checklist, and if you're a new pilot, are you arguing with Chuck Yeager? Or are you saying, okay, I'm in, I'll do that? All right, the dude died of natural causes at age 96 as a test pilot for 50 years. So I would assume what he is doing is correct until proven otherwise, right? He's like, and he was the ultimate mellow yellow, right? So Chuck Yeager would be in like a death spin, and the dudes on the ground are conditioned black. They're like, holy fuck, he's going to be a hole in the ground. And he'd be like, we've got a little problem here, trying to figure it out. And he's like spinning at 11 Gs. And you hear the remnants of Chuck Yeager's voice every time your commercial plane goes through turbulence. And that Southwest pilot in a draw, even if they're from New York, right? They talk in this draw. Sorry about that. Might hit a little turbulence here. Y'all know that voice? That's Chuck Yeager. They're all kind of embracing Chuck Yeager, but that's a diversion. Yeah, so Bessel van der Kolk, Kevin Gilmartin, and Dave Grossman have all been in this space for 40 to 50 years. So Bessel van der Kolk is a psychiatrist who started dealing with Vietnam vets at the VA. I believe he was outside of Boston in the 70s. They didn't even have a term called PTSD then. It was shell shock in World War I, combat fatigue, post-Vietnam syndrome. But he started politicking to the heads of the psychiatry, whatever their organization is, who puts out what's called the DSM, the Diagnostic Statistical Manual, which is a taxonomy of diagnoses for mental health conditions, which are symptom checklists. There's which has a purpose, but it's the original purpose of the book, as van der Kolk has described, has been hijacked. It was originally designed to help with clinical care, but basically it became a billing and coding tool where if you didn't have X diagnosis by these criteria, you couldn't qualify for X medication. But he really presented to the American Psychiatric Society that there was a subset of people that had big T trauma, right? Big T trauma. So big T trauma, as Besselkoff describes, is trauma that would stop you in your tracks. Visceral, right? The body keeps the score. So if you're thinking now of the worst thing you ever experienced, I don't want you to go there if that's going to cause you trauma. You feel it in your gut, right? It's visceral, right? Heartbreak, it's visceral. So the body manifests trauma with physiology, right? Stress hormones, symptomatology. It's not in your head. The body keeps the score. So he was the lead in creating PTSD as a taxonomy of diagnosis in this manual. So now there is a checklist diagnosis of PTSD, but he describes all that is a taxonomy checklist. It depends on who you see, because you could go see one person and you meet the checklist for bipolar because you're like angry and stressed all the time, and then you go home and crash. Kevin Gilmartin describes bipolar, right? You're on duty, highly vigilant, highly stressed. You get angry quickly because that's your adrenal glands firing. And then you come home and you're angry and you're detached in a different way. You're kind of here and you're kind of here, so you could describe it depression, right? Depending on when people see you, they could say, well, gosh, I'm seeing Frank at home. He's depressed. But you're on duty, buddy. Is like, man, Frank is freaking manic, because he's like on duty. He's like manic, he's like on and he's manic. But like there's a lot of crossover, so in my mental health categories, any mental health disorder has, because none of these guys had a mental health disorder when they joined. So none of this is like genetic, right? These people had zero mental health conditions or they would not have been allowed in. So they don't let people in to combat who have bipolar. So all of these mental health conditions developed during post-combat. So it's kind of a clean group. So the people who aren't responding, who are gaining weight, every single one of them so far, and it's only about 30 out of the 200 haven't lost weight. So we have to ask, well, what's happening with those 30 who aren't who aren't losing weight? And across the board, they have mental health. And when you talk to them, it's active. It's not dormant, right? Like dormant, gosh, I went through, Price was on the call, right? I had, man, I really struggled with alcoholism 5 years ago, and I'm good now. I'm good now, but it's active. So these people have it active. And of the group who have metabolic syndrome, so they estimate post 9/11 combat vets, about 20% meet criteria for PTSD, which is a big number. After World War II, it was like 3%. Now, there wasn't the diagnosis then, so they're going back into charts and trying to make the diagnosis. So is that just more like now they're identifying it more, or is there really more PTSD? And most of the authorities will say, no, shit, there's more PTSD now than there was after World War II. And so 80% of my veterans who have metabolic syndrome have a mental health diagnosis. So 20% of people in that cohort, who are just coming to the VA have the diagnosis. But of the people with metabolic syndrome, 80% have some mental health diagnosis. So and in the presentation, this is not new in the literature. The literature goes back to like 1990 on the connection of stress and PTS and metabolic syndrome and diabetes. So this isn't like a new finding. It just confirms what people are seeing. But unless there's a way out, we're just looking at data. And that's what we're trying to do, is like, okay, how can we help these guys? How can we get them out of the well? As Chris Palmer stated, they're in the well. So the ones that are doing well, mental health tends to be better. They got a stable job. They're not going through their fourth divorce. They can pay their bills. The ones who are struggling with their metabolic health are struggling with their mental health. So I'll take in the second visit the ones who are struggling, which actually is a very joyful way to do clinical medicine. So man, like, you're not losing weight, so I'm not doubling down on the diet. It's like, well, what's going on with your mental health? Because they heard about the diet, right? Like, they don't want to hear about the diet. And then you start building some trust with them, and you draw more pictures of Kevin Gilmartin's roller coaster and condition yellow, red, black, all these things, and they're like, yeah, that makes sense. So I hope the next visit down the road after that conversation, and the VA, fortunately, compared to the civilian sector, has good mental health care. So I'm blessed that if a vet, some of the care is good and some might not be optimal for that veteran, because they tend to, as Bessel van der Kolk writes in The Body Keeps the Score, vets respond to being with other vets. There's something about that bond, like you guys on this call. So back to the World War II and the post 9/11 vets. So what was different in World War II than now? So if you went, and I had a slide of this, so if you look up, you can Google return from post World War II. You had a 2-month decompression on a ship with like 2,000 other vets. You come home to ticker tape parades, and every single neighbor you have is a vet who survived. Right? So you came home to a place that wasn't like foreign. And then you listen to Sebastian Younger. He has a TED Talk, because why do veterans want to go back to war? Listen to that. And you're like, holy shit, this is real. So now these guys get what's called a DROS, right? Date of return of service. They punch their ticket, they get on a C-130, get on a C-17, and they go from combat to their neighborhood in like 48 hours by themselves. Maybe a couple other people, but it's not with like the group they trained with, deployed with. And then they come back to the neighborhood and they're like looking around and they're like, this is a very isolating, lonely place. I don't like it back here. Send me back down range. They're like, send me back to war. So it's like these guys. So what do vets respond to? It should be similar to cops. So, and again, this isn't me. If Bessel van der Kolk in The Body Keeps the Score, who's been studying PTSD for 50 years, says this is true, that's like Kevin saying this is true, or Dave Grossman, right, on combat, he's been dealing with this topic for 40 years. If he says this is true, I believe it's true. So, Bessel van der Kolk says cops, or vets, cops, the trauma of the PTS and the stress sits in the right brain. A lot of that trauma sits in the right brain. So we'll keep it simple cop language here, doc language. I'm a vet, right? So left brain is language, STEM stuff, IT stuff, left brain is, if you have two kids, you may have one right brain kid, right? The dancer, the artist, the musician. Then you have the left brain kid who can like do math like you read about, who knows square roots of stuff. So most of our therapies are left brain. We talk to somebody, right? You cognitive behavior therapy, psychotherapy, talking to someone, talk therapy, and medications kind of blunt some of that way. You're kind of highly stressed, crash. So the meds have some effect, but in vets, very little. The data on medication for vets is pretty bleak, but we tend to want to do it because it's there. But how many have heard of the term somatic therapy, like soma? So soma means of the body. So as a doctor, when we were told somatic, that was like the malingerers. Well, that patient is somaticizing, and what negatively us as uneducated idiot doctors felt, somaticizing, right? So they have somatic abdominal pain. They're coming in and they say their stomach hurts, and we do a CAT scan and their stomach looks fine, right? There's no organic disease. So we called them somaticizers, meaning their body was manifesting a symptom that we couldn't see as disease. And I never asked a single person when I was in medical school, well, did you get beat up by your dad? Did the priest rape you? Did your father rape you? All this big T trauma, right? That's big T trauma. We call them ACEs, adverse childhood events. Like we never went there. But we viewed that as like a negative, like that's a malingering patient. But no, that's real. So somatic therapy is involving the body, movement. So motorcycle, dance, yoga, run, sing. Here's a story. I had a veteran. He had the worst PTSD and Army guy, and he was an amazing singer. So he gets out and he's like in the well doing it with his PTSD. He's can't do anything dysfunctional, but he's a good singer, and his friend convinced him to start singing again. And he was an opera singer, world class. So now he starts singing opera, traveling the world singing opera. And I was like, man, how are you feeling when oh man, that was like, I was getting better, until one day he's singing opera on a stage in Spain during some national celebration. And guess what got shot off? Firecrackers. So he's singing and he goes to condition black on the stage, right? Black, like I'm done, right? So he was like really doing well, and that set him back. But then we call it desensitization reprocessing. So the therapy for, how you move through that is, okay, like your brain, let's go back, let's desensitize. What am I going to do next time? But that just shows you what, like he's growing. He's full catastrophe PTSD. And we all talk about obesity a lot on the show. Maybe I'll finish with Marcus Luttrell and just what he described. So Marcus Luttrell was a SEAL. They made a movie out of him. Mark Wahlberg, played him, and one SEAL survived, 19 died that day. They got ambushed, and the plane of SEALs went down trying to rescue him, and then the PJs pulled him out. So he comes home. He's a Texas boy. He's a SEAL, and he described it on his podcast with Dave Grossman. He has a podcast called Team Never Quit, which would be a nice one. You guys, it would totally connect with you guys. So he's a Texas boy, so he goes back to the ranch, lives on Rick Perry's ranch, gets a dog, right? Dogs are really good for that. He said, I was 500 pounds overweight PTSD when he got back, right? Like not literally, but like not doing too well. And then a year later, he's a Texas boy. What's he doing for somatic therapy? I'm sure he's out fishing and hunting and doing jujitsu and, whatever you would do. He had a twin brother. You beat the shit out of your brother and all that stuff, like we all did. I had 3 brothers. I mean, that was good for us, right? That's what we did. And then like a year later, they gave him the choice. They said, well, Marcus, you can retire, medically retire. You can go back down range. What do you think he did? He went back to Iraq. He said at that time he was probably like 50 pounds overweight PTSD. Right? Not fully better, but 50 pounds overweight PTSD. So he was good. Like in a year, and Grossman describes it like this: post-traumatic injury, and then there can be growth. The disorder, the D is when you're stuck. When you're stuck, right? That you can't move forward. Like, a simple example would be a couple weeks ago was an article in CNN about Sully's plane that landed in the Hudson. right? That would be big T trauma, for most people, unless you had practiced that as a SEAL, right? Maybe they'd practice that. But if you were like me or any commercial passenger, like your engine's going out and prepare for impact and landing in a river in the river would be a little bit of trauma. That's big T, right? Little T trauma is I mean, can we say bullshit on the show since Kevin talks about bullshit? Little T trauma is I survived the pandemic. That pandemic was so horrible. I survived the pandemic. I had to wear a mask and like, oh, shut the hell up, right? That's not like any of you guys. If someone said that was trauma, you'd roll your eyes and just like, oh, please let me not say anything. So 15 years later, that was 15 years ago, there are still people who cannot get on a plane, like can't get near a plane, like they're stuck. Now it's fine if you don't need to get on a plane, right? Just live in West Virginia and go hunt for your food. But if your life involves like you have to get on a plane, but there are people like a week later are back on the plane. There are guys that day back on the plane. They had to get home, but so like there are people that like, oh man, like I'm sure like even the people that were able to get on a plane in the next week or two, that was probably not easy like us, like you're probably listening to that flight safety check a little closer, instead of checking your email, on your phone while they're telling you where the emergency exits are. But they're 15 years later, there's still people who are stuck, no growth. So what we want to do with cops, vets, or anyone who's had big T trauma is get them the right therapy so they can reprocess what the trauma is. And that's why like ketamine therapy now, MDMA, psilocybin, these people that are 10 years later who are still stuck, like they can't, their identity now is PTSD, right? I'm a PTSD veteran, I'm on 100% disability. This is me. I'll never get out of the situation. They'll never get out of the situation. Like you have to believe you can get out of the situation. But I've gone 45 minutes there, and I know those of you that are Ravens fans are mourning right now. I'm from Baltimore. It kind of sucked, those interceptions. But we'll open it up for questions. But I just wanted to kind of share that connection of stress and PTS and metabolic illness is 100% real. Hundreds of articles showing that it's called neurophysiology. Our brain makes stress hormones, which affect the body. Read The Body Keeps the Score, read On Combat, reread Kevin's book. There's another book that I really like. It was called Once a Warrior, Always a Warrior. His Hogue he's a psychiatrist for the Army, but another, I mean, they all are kind of speaking the same language, coming at it from slightly different places. But it's interesting when you read these books, it's all different flavors of the same ice cream, basically, from what they've witnessed. But the solution is, you can get out of it, stress acclimatization, like as Kevin talks about emotional management. So helping each other, not managing them. There's a little story. So A.A. Milne, who wrote the Winnie the Pooh stories, right? People are like, Winnie the Pooh, what the hell's that all about? So he had the worst PTSD. He was a World War I combat vet, and all of his characters came out of his PTSD mind. So there's a little story of Eeyore sitting in this tent, like doesn't want to come out, and he's all sad and he's just depressed. Eeyore was kind of a depressed character. And Pooh and Piglet just go and, they said, we're worried about you. And they just sat with Eeyore. Didn't want to fix him, didn't want to manage him, just sat with him. And all of a sudden, Eeyore started feeling better. And that's it, right? Like if you have a buddy, I'm sure everyone on this call right now has someone who's a little bit in a bad place, a lot in a bad place. And if has anyone reached out to any of you and said, hey, dude, thinking about you, how you doing? Has anyone had that happen to them? Yeah. And has that made you feel pretty good? Did that person want to manage you or fix your ass, or that person just wanted to, no, right? They just want to be there with you. Yeah. So, I think in healthcare, I mean, it's all driven by big pharma, right? They just want you under their control, like big medicine, big healthcare. You can't manage yourself. We have to manage you with more weight loss programs, coaching, dietitians, psychiatrists. But sometimes like vets respond to being with other vets, and they respond to movement, right? So that's the vets. So the vets respond for their PTS by soma, movement, and they respond to being with other vets. And when the vets get together and ride their motorcycles, go to the shooting range together or play basketball together, go fishing together, they're not trying to fix each other. Be frank, I'm trying to fix your ass, dude. No, we're just, hey, dude, you want to go fish today? Or, go hunt today, go to the range today, whatever it is. I'm a runner. Let's go out in the trail and go run today. That's like super powerful for your colleague. Not You're not trying to fix them. It's not in your wheelhouse to fix them. But if you think they really need something, like they want to harm themselves, that's a different story, right? Get them help. All right, so that's all I got. But throw out for questions if any of you all have anything, or any medical questions. Even though this is recorded, you don't have to share your name, but anything that would be fair game for your colleagues. That's a common question. But
Doc, I just want to say thank you so much, man, for your dedication and your time, and this is such an important topic that needs to be. I feel like that, being in the wellness space and being in the wellness space within the police department and in rep for responders, I think we're seeing a change slowly across the country, right? There definitely is a change. When I first started on the job in 2015, for sure. We speak about this topic all the time. We speak about substances, right? And we're talking about, and when I mean substances, I'm referring to alcohol right now. And uh, what I say a lot is, if you are diagnosed with PTS, depression, anxiety, right? When we're drinking, it's kind of I say it's PTS, anxiety, depression on steroids, right? It makes it much stronger, makes it more real. Uh, it's slowing our systems down. But another poison that we don't speak a lot, and I would say that the percent is very high of how many cops, I'm going to speak from the cop point of view because I am one, not only use but probably abuse stimulants such as nicotine and caffeine. And this was just brought up in our chat, in our call a few weeks ago. Now there's so many ways to get nicotine, right? Instead of smoking, you have the vape, you have chewing tobacco, you have the nicotine pouches. I mean, you see all these young guys, young, old, but social media now is a cool thing to do. With your expertise in regards to not only if you're suffering from or diagnosed, I don't want to use that word suffering, diagnosed with anxiety, depression, or you're you're revved up, right? Your fight or flight is always on. Um, your thought process on the stimulant affecting not only mental well-being or your parasympathetic nervous system or your sympathetic nervous system, but the inflammation or the heart disease in the future, because there's guys that, you can go on throughout the day. And actually I'm changing to 12-hour tours this week, 3 days on, 3 days off. The NYPD is piloting. So we work 3 12-hour shifts. We're off 3 days. We work 3 12-hour shifts. We're off 3 days. We were doing 5 on, 2 off, 5 on, 3 off. So probably going to see a lot more of that. So just whatever you got with us, because I feel like that also, that little hidden gem, right? But also has a huge toll on our nervous system and how our heart rate fluctuates throughout the day. And then it's not helping with that hypervigilance and that crash when we get home. And I'm saying this because I definitely fall in that category.
yeah, so Dave Grossman caught, like, if you listen to any of his recent podcasts that wrote the book on combat, he says poor sleep is the epidemic. Poor sleep is the epidemic, and rotating shifts is the epidemic. Because when you're like, 18 hours sound sleep, you're at like 0.7, 24 hours without good sleep, you're at a 1.0. So
Yeah, sorry, I
basically,
don't mean to cut you off, but I have the notes from Dr. Kevin Gilmartin. So 24 hours up equal 0.10 blood alcohol content.
yeah,
18
0.10,
hours
yeah.
up 0.08. And then another statistic is 83% of police officers inadequate sleep, about 4 to 6 hours from the study that they did.
Yeah, because when you're on, so it's funny, those two guys pull the same damn numbers, that they are brothers from another mother, so the sleep, compared to firefighters, right? You got a 3-day weekend, you're in the safe zone, you go out for a call, you're 48 on, 70, 3 days off, 9, whatever your shift is. But you guys are rotating shifts, picking up overtime. Like the bill comes due. I mean, because like when you're rotating, I did a lot of rotating shifts and night call as a doc, and you're basically just rolling on stimulants because you'll have a whole night that you didn't sleep, but you still have a day job the next day because you were on call, and you can get away with it when you're 30, but it definitely takes its toll. But I think that's more along the lines of leadership to create. We had a program in the Air Force for flyers that they sold to industry. It was called the FAST, Fatigue Assessment Strategic Tool. Like you could even put that in Google. So what we would do is we would plug into a computer, the schedule, and it would be like a DUI curve. And it had, it was like it was NASA design type of product. But my 8 hours of sleep in the middle of the day versus my 8 hours of sleep at night, whether quality sleep, like it made a difference in your DUI curve when the sleep was. Like it wasn't just the hours of sleep, but you could, and that's how you would predict crew rest, mandatory crew rest. Oh shit, Frank, you got to do overtime. No, it's mandatory crew rest, because at the end of X numbers of shifts, you start in the green ideally, but some of these young knuckleheads would be out partying and show up. Ideally they would have shown up for work rested, but you all know that that's not true, right? They got families, their wife's yelling at them, their kid overdosed, right? And then they show up, they're already tired when they show up to work. They're coaching Little League and now they're on night shift. So it's real. And I know you could even look into that program because I think you can buy it now. Fatigue Assessment Strategic Tool. Just like put that into Google, but most of it's your common sense. Like it's a computer program, with AI logic that'll tell you you're drunk. That because you can't do a blood test for that, and that and we know that sleep deprived state and metabolic syndrome travel together too, because that affects your insulin resistance. And I'm sure there are multiple mechanisms of why that is. We're sleep deprived or ghrelin. Amy could probably share some of the, the gut hormones, PPY, leptin, ghrelin. Our bodies don't respond to the satiety type of signals that they do when we all know when we're really super overtired. It's easy just to overeat, because hormones always win. If our body's in a battle with its hormones, who wins? The hormones every time. And so, yeah, like the sleep of cops is a hot mess and probably needs to be looked at, at a systemic level to make sure you guys do have rotating shifts. Rotating shifts is just a mess, and doing overtime. But if you don't recover, it's no good. But then, quality of sleep. So Grossman describes this in his book. So why is this sleep such a much more of a hot mess now than it was, so first Persian Gulf War, I think maybe Amy was in during that time. So post 9/11 was the first time they had Wi-Fi, at downrange, right? Like Bagram Air Base, a different place, they have Wi-Fi. So old school, like you're outside the wire, you're in combat, you're like you guys on patrol, you come home and maybe you'd hang out at the camp with your buddy and you'd go to sleep. You're like high adrenaline and you come home and you crash. You sleep and you sleep hard. But now, and this is probably cops going home, they come home and they're like in this highly stressed state. And now you've got a phone and now you've got video games. So instead of like, okay, let me chat with my buddy, have a meal, and I'm just going to crash. Now you're like on this thing, on your Facebook page, calling home, texting home, playing video games. I mean, so if Dave Grossman has observed that and he says he thinks that's real and that's a big problem of the sleep, I'm just his disciple saying until proven otherwise. And thinking back, you're like, yeah, that makes sense. And the other thing he says, which makes sense and which maybe makes sense for modern copying. So the sustainable, constant high ops tempo of modern military combat with technology is so different than older types of warfare. I mean, that was more brutal probably, but as far as like constant, like every minute of the day, shit's going on. Older types of combat, you'd go, kill the enemy, in some trenches, which was horrible. But then you come back and, right, like I'm back, and it's not like 10 minutes later you're back doing something else. But I would just suggest read the book. Actually, his co-author of that book is Lauren Christensen, who's a career LE. So the book On Combat is basically an LE book because Grossman and Christensen wrote that book together. So and he quotes Gil Martin in that book, which is wonderful. So they're all, but sometimes it's good to read things from a slightly different perspective, and it puts things together and gives you ideas of solutions. So we can all understand this stuff, but unless we make solutions, we're just on phone calls saying, man, this is all real, but we have to find solutions at the grassroots level. And that's what I'm trying to do, is one veteran at a time, restore them to, good health, right? Not medicate them to the teeth. I mean, that should be the goal, you would think, but it's not the goal of modern medicine. The goal of modern medicine is to manage everybody. And we all give ourselves a pat on the back for our quality metrics. But I respectfully say to my colleagues, if we're doing such a great job, why is there not a single damn healthy person in our patient population? Why is not a single person walking into my office healthy? I'm good. Have a nice year. Once a week, I'll have someone who's like, well, I'm here for my annual checkup. Everything's good. Good. Come back in a year. $400 billion of type 2 diabetes expense in the US, $800 billion national defense budget. It's not sustainable for the survival of our nation. The poor health of our cops, our veterans, and our citizens is destroying the viability. It's destroying national security, social security, homeland security, everything. Yeah. Yeah, I've seen that. Yes, On Combat. That's the name of the book. And his first book was called On Killing. Dave Grossman. Just find it, listen to it. Yeah, and then Bessel van der Kolk, Body Keeps the Score. Like, it's the treatise on PTSD. It's basically the Bible on PTSD. He's like 80 years old now. Listen to these guys on podcasts, because sometimes, like listening to Kevin on a podcast, like you can read the book, but when you hear them in conversation, it's like, read the book and then you hear them in conversation, and it synthesizes like the real important things in like plain language conversation. So I love listening. Every time I listen to one of these guys, I'll just put their name. I'll put Kevin Gilmartin in my in my search thing for YouTube videos, and just listen to them talk, and it helps me talk to other veterans or cops. Half of my, not half, but a number of veterans, right? They like to go down range again, right? So they come home. I hate this, isolated. So what do vets do when they get out of the service, right? They go work for Blackwater. They join the Secret Service. they become security guards, or they become cops, because they don't like this. Men love adrenaline. Young men love adrenaline, who have seen adrenaline, right? Like this, these aren't your video game youth. These guys love adrenaline, and they don't like jobs that are boring. Like that's why they become cops or other types of jobs that are first responder type. Yeah, so I'm sorry to ramble there, but we're at 8. I don't know. Is anyone else?
And
So
no, thank you, Mark.
I gave you some homework to read. That's, if I can just open your minds to things that will open your mind, I think it's been worth the hour, to give you things to think about.
Yeah,
Because I'm
no,
still
absolutely.
constantly
Thank you.
reading. Like I'm no authority on anything. I just like learn from you guys and learn from my patients. But any questions, comments, thoughts? Like if anyone out there has any thoughts on, from
I,
their own perspective
I
that
got,
could
I
help the
got,
group.
I got a comment, Mark. That was one of the best you've ever done. I'm really pleased that we got this out so quickly. We've got 3 chiefs on this call: Chief Hart, Chief Flannelly, and Chief Petrelli, who are all thinking the same way. I'm so happy they jumped on. Lauren, Jonette, Amy. This couldn't have been any better, ladies and gentlemen. Dr. Mark Cucuzzella, best of the best. Don't you all
I
agree?
learned from you, Greenie. We did that LAPD thing like 10 years ago. That was pretty wild.
Yeah, wasn't it?
It was probably
Wasn't that
almost 10
fun?
years ago. It was.
Yeah.
Do it again.
Thank you, Greenie, and thank you for, always making this happen and believing in the mission. So,
Yeah, I'll share one. I'll share
Yeah.
one other thing I learned from Grossman, which reaffirmed. So we all come home, and you're like super stressed, and you come home and sit in the chair. So like, here's some tea. So what Grossman describes is always have a drink of water. Like the act of swallowing calms you down and box breathing. So I've been in this trap too, doing ICU shifts and shit. You come home and you've already pounded like 2 drinks before you've even said hi to your family, right? Because you come home and just that act of swallowing calms you down, right? Every critical incident debriefing, there's bottles of water around the table. So if you know your tendency is to come home after a stressful day and eat or drink, right? Not water, but to drink alcohol, always, always, always have something to drink. That's that act. Always have water with you. I mean, it seemed too simple to, but it's like, yeah, that shit makes sense, right? And box breathing, right? That four, but just the power of always having something to drink. This is tea. It's like no caffeine tea because it's 8 o'clock. But I mean, if any of you all on the call just thinking back, realize that, like, just if you've had water near you, just drinking water if you're at a debriefing, and if like water around the table, and it just tends to be like, okay, like it's going a little better now, just the act of drinking that water. But these are like no cost things to do and try. Always have your water friend with you if you're under stress. Gulping, parasympathetic, calms you down. Nasal breathing. Fight or flight, feed and breed. That's how Grossman describes it, right? Fight or flight, feed and breed, right? You come home and boom.
Frank,
yeah, thank
All
you,
right.
guys. Hello.
Well, good.
hello. I'm here. How you doing? This is Frank, the other Frank. Good evening, everyone. You just hit a big point on me. Last Monday was my 1 year anniversary of a new kidney, and I bring it up all the time. But you bring up a good point about water. Water, I'm finding, obviously, it helps, flush me out and so forth. My kidney and my creatinine keeps it low. But I find I'm drinking a lot. That they always tell me, are you drinking your water? Are you drinking water? But I'm drinking more water, and it's finding that it's making me feel better.
Mm-hmm.
My body reacts to it as a flushing agent, and as I say, it flushes out all the evil spirits. And the black hole, if I get the evil spirits out of me, my black hole has no competitive against me for me to do my crazy stuff, which I've done back years ago, which I have no feeling of doing, thank God. But water is a big entity of us. I know Frankie always says that, he drinking water. But of course, when he comes over the house, he loves my flavored drinks here, and it comes strolling in with a smile on his face. And I said, "Where'd you get that?" But water is a big factor, and it is common. And obviously, I'm like a sprinkler system, but other than that, it makes me feel much better. And I want to say thank you for bringing up about sleep. Sleep is a big issue, especially with people, first responders. I'm a first responder. I'm also finding that I get too busy. I get too wound up lately. The last 2 weeks again, I'm wound up again. My immune system's low. And I find that, when I do my numbers, I can see a difference in that. So sometimes you got to make sure you get that sleep and you take care of your body, and makes you feel better, and you feel like a better person. So on that note, I want to wish everybody a good night. Have a good evening. And if anybody else has something to say, you got the floor.
Thank you,
Have a
Frank.
good night. 10-4, over and out.
Thank you, Big Frank. And thank you, Dr. Cucuzzella. We'll have
One
time
more
for,
thing. One more thing.
yeah, why
And I
not?
have no
Sure.
problem interrupting.
Take it back.
Happy Valentine's Day to everybody. Bye now.
I know. The season of love. Yeah, it's funny he says that because growing up in a household with him for about 25 years, uh, he never drank water. And I was like, how is this guy surviving? How is he doing it? And I could definitely see, in his recovery and, the kidney was an amazing blessing. Uh, Definitely a huge change. And I'm very grateful for that. So if anyone has any more questions or comments, we have time for one more. Um, it could be on anything or checking in or anything that Dr. Cucuzzella said, or maybe he didn't say. Um, the time is now. There's no time like the present moment.
I just want to say thanks, Mark. It was great to hear you speak again. And it's great to have you on.
Keep doing good stuff with the mental health.
Yeah, I'm trying.
I use Chris's handout a lot in my clinic.
Good. I'm
Yeah.
really glad. Yeah, I'm really
Yeah,
glad. Yeah, it's
many copies of that.
important. Yeah, no, it's good. Yeah, it's like you were talking about how it's all interconnected, and you can't look at just one part and ignore the rest, because then you're never going to have success in any of it. So I mean, that's what I've found for sure, is really it's all of it. And so yeah, that just really resonated. So I remember listening to a great it was between Peter Attia and Huberman podcast, and it's great information and all this stuff, and about health, and at the end of it I just thought, well, they didn't really touch on mental health too much, and I was like, at the end of the day, none of this really matters if you don't have support, if you don't have a purpose, if you don't like all these things that they're suggesting to do just really kind of fall flat. If you're too depressed to get up, or you don't have support, or like you said, you don't have somebody to check in on you and help you through it, you don't have the healthcare system or a physician that has your back and all those things, it's really hard to really achieve all these things. So I like you pointing out just drinking water, just doing these things, because I think a lot of us are so overwhelmed with information, and then I feel like it's like, well, if I don't do this, if I don't get this, if I don't get sunlight in the morning, if I don't do this, then it's going to be a fail,
yeah.
right? It's just too overwhelming for people, for me. And so I'm saying this personally, but also in talking to other people. If you don't check all these 5 boxes, and I'm meditating every day and I'm doing all these things, then it's a fail. It's a fail. And it's not to say that those aren't all important. And that's kind of like doing the comprehensive, but I think it's just the small things, like, yeah, sitting there, doing the box breathing, drinking some water, things that you can actively do, and it doesn't take very long. Or else, me personally, you feel like this epic fail because I haven't checked all the Huberman boxes or something.
Real.
It's just so, yeah, it's a lot. So I feel like just doing small little things, changing habits over time, things like that are really important and hard. And yeah, I was listening to another podcast with Ben Bergeron, who's a legendary CrossFit coach, and the question came up about how hard it is to kind of maintain meditation and things like that. So, he said even he did it for 2 years and it dropped off. So he said, you know what, it's not even a habit, because if it drops off, it's not there yet, and so just kind of restarting, not thinking yourself of a failure, just kind of, yeah, taking small steps instead of big leaps sometimes is all you can do.
Yeah, we have to treat sleep like everyone pays attention. Their workout's important, their diet's important, but we have to actually think of sleep in the same way. Like I need to think of my sleep as important as my weightlifting session, my run. And then because I think we kind of try to squeeze all this other stuff that Huberman and all these people want you to do. And how many hours are in a day, Lauren? It's like, and then you got your kids, and and it's like, oh shit, well, I can dial back my sleep to get no, absolutely not true. It's like the Swiss
right. No, I think sleep is definitely, yeah. And that's why you know, like the going to the shifts that they're going to now that Frank's been talking about. It's going to be tough and even more important to kind of maintain that because everything's going to kind of go out of whack a little bit, I feel like, or it sounds like, Frank, you know, just the new shift system you were talking about, the 12 hours on for 3 days. And yeah, I don't know what the solution is for that, but yeah, I agree, Mark. I feel like sleep definitely takes a back seat for sure. It did for me forever and ever. Yeah, with kids and residency and all those things. And yeah, I still got to get my run in. I still have to get my workout in and things like that. So yeah, I think just being realistic and yeah.
Well, cool. Well, we'll let you guys
Thank
sign
you.
off and watch who's the next game? Lions and 49ers.
Yeah,
I'm
thank
not. I'm bummed for the Ravens. So I'm kind of done with football for the year. So whatever happens now. All right.
Thank you, Lauren. Thank you,
Thank
Dr.
you
Cucuzzella.
all.
I appreciate you,
Thank you, Lauren.
the information. And again,
Thanks,
this
everyone.
will be up recorded probably in about the end of the week, Greenie. So this will be on our YouTube channel. And as always, we have a nice way of closing for all the sick and suffering on the screen, off the screen, for everyone who wanted to be here tonight and couldn't make it, maybe because they're working or they had that family stuff get in the way, and also for any first responder and military personnel that doesn't even know that this meeting exists, and we're here for them. So a moment of silence, followed by the serenity prayer. God grant us the serenity to accept the things we cannot change, the courage to change the things that we can, and the wisdom to know the difference. Amen, everybody. Be safe. Have a great week. Doc, thank you very much, sir. And keep up the good fight, everybody. Bye now. Be safe.
Bye.
One last thing. Be that Winnie or Pooh or Piglet for somebody else this week, because then you'll
There you go.
realize
Dude, how you doing, lady?
that
How you doing?
you needed it also. So God bless everybody. Have a good night. Bye now.